Okay, I'd like to call this meeting of Warrensburg Town Board to order. Rich, you want to lead us in the pledge of allegiance?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, I'd like to welcome everybody. We do have a full agenda tonight. The first item on the agenda is public hearing for citizens' participation and comment on the Community Development Block Grant funded by the Housing Rehab Program. And ask the clerk to read the legal notice, please.
The Town of Warrensburg, notice of public hearing. Please take notice. The Town of Warrensburg will hold a public hearing on August 10th, 2022 at 7 p.m. at the Town Hall, Warrensburg, for the purpose of citizens' participation and comments on the Community Development Block Grant Funding Housing Rehabilitation Program. The CDBG program is administered by the New York State Office of Community Renewal, and the Town of Warrensburg is applying for $400,000 to make available to eligible town residents towards Warrensburg housing rehabilitation. In accordance with the citizen participation requirements detailed in section 570.486, 24 CFR, the Town of Warrensburg will fully describe the proposed project and activities, describe where the activities will be carried out, explain how this project meets the primary national objectives, and describe the estimated schedule to accomplish the proposed activity. Draft pre-application materials will be available for public review at the public hearing and upon request from August 1st to August 22nd, 2022. All comments and requests may be submitted in writing to the Warrensburg Town Hall, Warrensburg, New York, or by emailing the town clerk. Please take further notice that the location of the public hearing is accessible to persons with disabilities, and all persons interested in this subject will be heard at this time and place.
Okay, we'll open this public hearing, and Rebecca, I'm going to butcher your last name, is Collier from Flatley Reed is here. If anybody has any questions about the application for the grant. If you do, please come up, state your name for the record, and ask your question. Oh, no question? Please come up, state your name for the record, and ask your, right towards that microphone right there, please.
Okay, hi. Linda Marcella, Town of Warrensburg. I don't have any questions, but I do say I'm so excited about this. How many years have we talked about finding a way to help lower income people fix up their houses, people who may never get the money needed to do it. So I'm really excited about it. I know EDC members have been going around town. I think today I almost got arrested because people wondered why I was going up and down my, but there's just so many of them, way more than we'll be able to help. But I think it's wonderful that we have this opportunity.
Thank you. Anyone else? Rebecca, do you have anything to offer? Or?
No, just
Okay,
If I may.
go ahead.
Rebecca,
yes.
I certainly appreciate the work that Flatley Reed has done on behalf of the community of Warrensburg. Maybe not everybody understands what we're going about. So a short explanation and perhaps the parameters of what people might anticipate in the dollar amount. Could you help us with those couple of things?
Sure. What we're doing right now is our consulting firm is assisting the town of Warrensburg with putting together the application for home improvement. And as we're going around and asking homeowners about what types of repairs they would like to address, we're also putting together some cost estimates. That in turn will help us determine how many people that we think that the grant will be able to assist. And so far, it's a wonderful turnout. I think we were just talking about, I think we have over 30 people. Good. And we'll just keep checking in with everyone. Timetable wise, we're hoping, things don't always go as quickly as they should with the state, but we poke and prod when we can to push them along. So we will keep everyone in the loop that does send in a pre-application. We'll be sending out letters on behalf of the town of Warrensburg. to let them know, the next steps and when the grant has been approved.
Thank you.
Thank you.
Any other questions for Rebecca or any other questions about the grant?
Quickly. Part of this process is building a list of contractors that meet certain criteria. Workman's comp, $1 million worth of insurance. And we're starting to get people that are more available to put their names on these lists. But if anybody is familiar with a contractor that might do any type of home repair, it's really important that we build a strong list to make this application go through. Thank you.
May I say one more thing?
Please come up and state your name for the record.
Okay.
Okay.
Linda Marcella, Town of Warrensburg. So it's my understanding, though, that to make us look stronger in the application process, that they'd like to see like double what we anticipate being able to do. So if we think we can have 30, we need the names of 60 people to add to that list. So if you know anyone, because maybe someone didn't see it in the paper or what have you, it does have to be primary residence. But if you know someone and if you chat about it, please make sure that they check with the clerk or check with the EDC program so they get their name on the list. And they don't have to be big projects. It could be just the front porch needs to be fixed or the part of the roof or what have you. So actually, the smaller some of the projects, the more people will be able to help.
Okay. Anybody else wish to comment on the public hearing on housing? We'll keep it open for a few minutes. We'll go to our next public hearing. Unless Pam, please read the notice.
Order setting public hearing concerning proposed Warrensburg ambulance district. Whereas the Warrensburg Town Board is considering forming an ambulance district covering the entire. Warrensburg, okay. Covering the entire town. Whereas the propose of the establishing the district is to ensure the health and safety of those in Warrensburg who may find themselves in need of emergency medical care. This is not only a crucial but potential life-saving endeavor which will benefit the people of the town in any event that emergency medical services are required. And whereas upon formation of the district, tax dollars acquired through the Warrensburg Ambulance District shall only be used by the district going forward. Whereas the town feels that having a specific budget item to designate funds towards the newly established ambulance district is paramount in terms of transparency and accessibility of such information to the people of the town of Warrensburg, and to provide the funds necessary for such services. And whereas a map, plan, and report has been prepared concerning the proposed district, which is copies on the table if you didn't get one. Whereas the map, plan, and report has been filed in the town clerk's office and is available for public inspection. And whereas the map, plan, and report is relevant to the entire area of the ambulance district, which will encompass the town of Warrensburg in its entirety. And whereas establishment of the proposed district has been determined to be an unlisted action under the State Environmental Quality Review Act, and seeker's short environmental assessment form has been prepared for the proposed district. Now therefore be it here is ordered, the boundaries of the proposed district will encompass the town of Warrensburg in its entirety. The map is attached to the map, plan, and report filed in the town clerk's office. Number 2, services to be provided include basic life support, transport, and treatment, and arranging for or providing advanced life support treatment and compliance with the regulations of the New York State Department of Health Bureau of Emergency Medical Services. These services will be provided by contract for the Warrensburg Ambulance District with the Warrensburg EMS Inc. For the first year, the operations of the Warrensburg Ambulance District, the maximum cost to be expended is estimated to be $362,000 for the contract for services and other district costs. No capital improvement costs are anticipated for the proposed district, so there will be no debt service costs related to the proposed district. Number 5, the estimated cost to be typical property in the district, which typical property is a vacant lot having an assessed value of $30,000 for the first year of operation, and the district is $29.88 as it relates to 50 parcels of land throughout the out the town. As for the typical 1 or 2 family residence properties, there are 2 typical values, $165,000 and $105,000. The cost for the first year of operation will be $104.58 or $164.34. There are 17 parcels that relate to each of these values. This estimated cost is based on a total cost for the first year of $362,000 divided by a total taxable assessed value of property in the town of $363,775,639, resulting in a tax rate of 0.996 per thousand of tax assessed value. Therefore, the estimated annual cost to typically property is $29.88 and $104.58 and $164.34 for the typical 1 or 2 family residence. A detailed explanation of how the estimated cost of the district is computed is included in the map plan report, which has been filed with the town clerk and is available for the public inspection. The town board hereby determines to conduct uncoordinated seeker review for the proposed district establishment. The town board shall meet and hold a public hearing at the town hall, Warrensburg, at 7 p.m. on Wednesday, August 10th, to consider the map plan and report and to hear all persons interested in the proposed district and to take such other and further action as may be required or authorized by law. The town board hereby authorizes and directs the town clerk to duly publish and post the order not less than 10 days, nor more than 20 days before the public hearing date as required by Town Law 209D, and to complete or arrange for securing of 2 affidavits publication. Affidavits of posting required hereby, and to file a certified copy of the order with the state comptroller on or about the date of the publication. Posting shall include placing on the town website. Good.
Okay, before we move on to the ambulance contract, are there any questions about the housing grant? Okay, I need a motion to close that public hearing. Motion by Councilman Alexander, second by Councilman Rounds. Rebecca, thank you. We're set. Okay. Now we'll open up on the ambulance district. So any questions on the ambulance district, please come up to the microphone, state your name for the record. Pam, can you turn that around?
Sure. Jim Hull, taxpayer, not code enforcement officer.
You want to take a chair up so you can sit down? You
Sure.
look uncomfortable.
I just want to make it clear, I'm speaking as a taxpayer, not the code enforcement officer. I'm not anti-emergency squad. I belonged to the emergency squad when it was hooked up to the fire company. I was a New York State certified EMT. While the emergency squad was with the fire company, my brother and myself and Chuck Badarian Jr. held the record for the most consecutive runs made in a 24-hour period in the emergency squad. I think you need to get a lot more facts and figures before you start voting on this district. I'd like to know how many runs they make to taxpayers within the town of Warrensburg. How many runs they make to the medical center, which the taxpayers already subsidize in tax grants down here. How many runs they make to Chestertown, Bolton Landing, Lake George, Thurman, Stony Creek, Luzerne, and what they're going to do, who's going to pay for all that stuff. We need to have numbers that go with what we're going to pay for here. I'm not in favor of subsidizing other towns that don't have emergency services. If they don't have them, they need to do something about it. You're going to tax the taxpayers of this town. If you listen to a scanner, The emergency squad is all over the place. They're in Corinth, not Corinth, but they're in Stony Creek, Luzerne, Bolton, Johnsburg, and that's the way it runs. I would think the town would be better served to do like the town of Corinth did and make them town employees, like Dick Lucia did over there. And made them town employees. They work for the town of Warrensburg, and that's who they serviced was the town of Warrensburg. And if you make this district, once they have a district, they're on their own. They can set whatever tax rate they want in the town. And every emergency squad, if you go back in their records, you will see that the very next year when they came back to the town boards, they wanted, Johnsburg wanted $85,000 more than what they raised in the year before. And they control the budget. And I think we're going to pay a lot of money for a lot of people to be going all over the place. And what are you going to do if somebody calls and wants an ambulance here and they're in Stony Creek? Because I'll tell you what, if that happens to me, I'm going to be coming here with a lawyer. And I'm going to want to know why my tax dollars are being spent for them to be in Stony Creek when I got somebody in my family that's dying of a heart attack. I think you're making a big mistake. I'm not anti-emergency squad. I belong to the emergency squad. But I think this district is a bad idea. I thought it was a bad idea for the library. The library came back, they have their own district. They raised the budget $250,000 in one shot, and the taxpayers are paying for that. How many people use a library other than internet service? Most people look up stuff today on a computer or on their cell phones. I'm not anti-library. But the taxpayers are going to pay for this thing. And I think it's a big nut to crack for these people. Some of these people are senior citizens, but I want to know how many runs they make to an individual house in Warrensburg, taxpayers of Warrensburg. I would want to know that if I was sitting in your shoes. I'd want to know how many trips they make to the med center. Because we subsidize the medical center through tax incentives. Those are people that are here on vacation, skiing, doing whatever. And we're going to subsidize to run them to the hospital and to send this ambulance all over to these other towns when they call for it. I just think it's a bad idea.
Thank you. Anybody else wish to address the board on the EMS contract?
I just have a couple.
State your name
Yep.
and where you live for
Joyce.
the record for the last time.
Joyce Reed, 191 River
Thank
Street.
you.
I just have a couple questions. Does the creation of this special district lie solely in the hands of the board, or does it go to public vote?
It only goes to public vote if somebody files a petition against it.
So the board can vote for it unless there's a petition, correct? That's my understanding. So, and it's,
Becomes effective after 30 days if no one files a petition. If a petition is filed, it becomes effective upon the approval vote.
okay, and what does how many signatures does it require on a petition?
5%,
It's 5% of the amount of people who voted.
less amount of people voted.
Okay,
Or registered, sorry. I don't remember.
I don't know.
is it voted or registered? Because that's a lot. Okay. Once the district is formed, it can't be dissolved, correct?
It used to be clear that you couldn't resolve the district without state legislation. When the past governor was in office, he passed the law that allows for consolidation and dissolution, like the Lake George Joint with the village, and also applies to the district. So there is a way to resolve it.
That's my next question. Can it,
That's a different thing. I also want to point out, the town is already paying for EMS service. The town is already paying for EMS service. The formation of a district does not, whether or not it's formed, they still can provide the same service that they have done in the past. They currently use general fund monies. They did it when you were on the board and voted for approving a contract. And this will not change that. It just changes it so that your bills now show how much of, it's not a general fund item, it'll appear as a separate tax item to show how much you pay for this precise service.
Right, but let's clarify, we pay 85,000 to the emergency squad, correct?
Incorrect.
Incorrect.
How much do we pay for the emergency?
80,000.
80,000. We pay 80,000 now. And we're forming a district encompassing 362,000, correct?
No, that's incorrect too.
Well, you have the budget here as
No,
362,000.
I had to ask. We have not done a budget. Mr. Hall is wrong
Okay.
on what Mr. Hall stated. He is wrong in his statements to the public.
Okay,
Okay?
so the $362,000 in district costs that you broke down for $100 for a $100,000 home is incorrect?
No, if it was a $100,000 home and we were to give them what they asked of us for an increase, and that's what it would be. We had to show the public potentially what it would cost a household if we were to give them the amount of money that they asked for. Now, there's been no budget passed. There's been no obligation made. They do not control the taxes. This town board controls the taxes. They do not set the tax rate. The town board sets the tax rate. Those are all incorrect statements that were made earlier. So, but that.
Well, that's why I'm
362
asking the
three-
questions, so the
Excuse
public,
me, I'm
sorry.
speaking. The $362,000 is based on 99.6 cents per thousand. So we had to come up with something to work at, but we could choose to negotiate a contract and a budget with the squad at a lot lesser money than that. We don't have to do the district. But again, if the residents want EMS service, you're going to have to pay for it. Please.
Is there any way of incorporating the school tax district into the proposed emergency district? No,
We don't go outside of our community.
okay. So will the town be handling anyway, running the emergency squad with the funds collected and distributed?
I don't understand.
Will the town have any control over it? Will the town board, once you've set the budget, have any control over what is billed, comes in, funds at the emergency squad?
The
So they'll
only-
be a separate entity unto themselves, like the fire district.
It will be a separate district. They will run their own operation. We will have a contract with the EMS organization like we do now, and we would distribute the tax funds on a schedule that we choose. But as far as the day-to-day operation of the emergency, I'm not going to run the emergency services.
And I think there's a confusion because I think a lot of people are more familiar with the fire district. A fire district is different than the type of district we're forming here. A fire district is the smallest municipal entity in state law. It has commissioners who are elected and get to set taxes. So when Mr. Hall was talking about districts, that might be what he's familiar with, because I know he's been on a commissioner for as long as I know. But this is not like that district. It is like a sewer district or a water district or a lighting district. It is basically a department of the town. And the town, when they set their budget, they put a line in there for districts. And it won't be included in the general fund group. It will be a separate item like your water and sewer and lighting. So it is, the district is controlled by the people who sit up there. And they are proposing to continue to provide the service the same way that they have historically, which is to have a contract with someone who is licensed to be able to go out and save lives, an emergency squad. And they will not be able to micromanage that squad, though there are provisions that they can put in their contract if there are specific things that they want to make sure that are part of the contract. That's a negotiation between two entities that get to choose what they agree on.
Thank,
I'm sorry, it's important to understand because a lot of people think, and I didn't know your library district is like Crandall Library District, apparently. It's its own state formed entity. Legislation must have formed it like Crandall and other libraries that I'm familiar with. But those are different and they get to set their own budgets and do taxes and their own people are elected. For this district, the people who are elected are the people who sit up there. It's like the other departments, the water and sewer, that they run.
I can't.
Corey said he's on his way.
Well, okay.
okay, I just think it was important. There's a lot of clarification. That's
And I
been
didn't
made,
try to
and
interrupt,
that's-
but I thought that clarification would be helpful.
Thank you. And is there a way that the board can set a tax cap so that if they come back and tell us, you're gonna set the amount that we give the emergency squad, the town board, correct? Is that what I'm understanding?
Correct.
So what if their budget comes in at 600,000?
We
There's-
negotiate.
Okay, and there's no cap. There's no
There isn't.
limit. That's fine.
There is none now. I mean, it's paid out of the general fund. I mean, they negotiate now every year
But technically, they will be part of the 2% tax cap.
for their budget, yes.
That's correct.
Okay, thank you. Thank you for the clarity.
Now, as far as the amount of runs made in Warrensburg, in 2021, they made 523 runs in Warrensburg, 65 runs in Thurman, 39 runs in Stony Creek, 56 runs in Lake George, 23 runs in Chestertown, 17 runs in Bolton, or 17 runs in Johnsburg. But those are all mutual aid when the other emergency services squads don't get out. They're all part of the mutual aid system, just like the fire departments are.
Matthew W. Kennedy, 2 Teresa James Street. I was a member of Warrensburg EMS from 99 to 2014. Now, I feel that the emergency squad could be double dipping because they're getting money from the town. They're also billing the patient's insurance. They also charge, they used to, they also charge for gas mileage. With this district, they will still be billing the patient's insurance. My opinion is they are double dipping the patient and they are double dipping the town.
Thank you.
Could you point out the fact that one of the budget is for Warrensburg services and they have separate contracts?
No, that's different. Anybody else wish to speak on the ambulance contract?
Susan Matzner, 792 Screwen River Road. If we're currently giving EMS $80,000, why do they need $362,000 for their budget? Why is there such a big jump?
I think the reason why, well, obviously it's in cost of providing 24/7 high-level coverage, ALS service for 24/7. And that's basically the jump is in
So
cost of the employees. They also want to pay towards insurance of some of the employees. The employees that they use now are independent contractors. So they hire them from a temp agency. These people do not get vacation time or any health insurance benefits. What they want to do is come into a more structured atmosphere and give them some future where they don't have to go out and service one town to the next town, to the next town, to the next town. We are not alone in creating this district. We are about the third town in the last 2 weeks to create a district. The reason why we're forced to do this is my opinion, is the state of New York will not let the county create an ambulance district. We have tried for 2.5 years to make this a county service where the towns that want to be part of this county service would pay through their tax dollars to be part of this county service. The state, we've asked the state to allow us to create an ambulance district up here for the county. They have refused for whatever. There's a lobby down in the southern part of the state, I think, that fight the bills, and it never gets through the state legislature. So we as towns are forced to take action if we want to, or negotiate contracts with our EMS service. And quite frankly, they do not collect enough money through the cost of a run to cover all their expenses. Medicaid and Medicare do not pay the $850 that it costs to do an ambulance run. They're lucky if they get $300 out of Medicaid or Medicare. So all this mileage and everything everybody's talking about does not cover the cost of an indigent person making a run. Now, as far as the number of runs from the health center, they probably do 18 runs a month. I asked for the statistics on what they're going out of the health center. It's a few more runs than what they normally do. But, and I'm talking with Hudson Headwaters to see if we could find some federal dollars to try to at least help our emergency services because of the amount of runs they do out of the health center. As far as the contracts that the emergency services has other contracts with the town of Thurman. And at one time, the contract was sufficing. It would, if you divided the number of runs into the amount of contract, they were doing pretty well getting the revenue from the town of Thurman. It's $50,000. They are not going to be part of this district. We are concerned only with the town of Warrensburg. And I, for one, think this is the right thing to do. I know some people don't think it's the right thing to do. If you look at what the city of Glens Falls did, they took their fire department, their paid professional fire department, and they go out on every run, and that service almost funds, believe it funds a lot of the fire department down there. Now, it's the sign of the times. Everybody bills for service in EMS. They have changed the laws this year to allow some of the fire districts, if they want to get involved, help out. Our membership in our fire department don't want to do ambulance runs. We all did ambulance runs for many, many years at a very reasonable cost. Things have changed. Things have changed immensely. The training to be an ALS technician is probably $5,000-6,000 to be trained to be one. It takes a lot of hours, a lot of time. And you got to remember, these people, a lot of these people doing this service are independent contractors. They don't have a home. So, I mean, you could make a full-blown squad like Lake George did. You could bring them onto payroll, but then the cost, and then we could take the revenue in, but it's not going to change the cost. The cost of the service is the cost of the service. It's how you pay for it is what it is. Now, that's the bottom line.
So what you're saying is by creating.
I can't
this-
just about hear it.
What you're saying is that by creating this district, they will not go to Thurman, or they will still go to Thurman?
That I can't answer that because I'm not going to control what the emergency squad does. We're going to have a contract with them to provide coverage for the town of Warrensburg. What they do, they're part of the mutual aid system, ma'am.
Right, no, I
So
understand that,
if another community doesn't have an ambulance, the county center is going to dispatch the next closest emergency squad. What they do with the town of Thurman is what they do with the town of Thurman. Obviously, he'd have to make arrangements to make sure that the town of Warrensburg is first base coverage. That would be part of us to write a a contract with the emergency squad to do our due diligence to make sure that they know that if we're going to give you X number of dollars for emergency services, Warrensburg needs to be the top priority for that. I can't say that they will never go to Thurman or Lake George or Chestertown or Stony Creek. It's a problem for everybody, and we're trying to solve the problem.
Okay, thank you.
Anybody else on the EMS contract?
My name's Sheila Mender, and I live at 3 Victory Court. I've had an opportunity a couple of times recently to use the EMS service, and we do need it. There's no question, and they do a great job. My concern is I've been reading the paper and following these public hearings, and I know we're not Bolton, and I know we're not Lake George, but our rate has come out much, much higher than anybody else's, even in Stony Creek's. And so I'm just curious, am I understanding from this earlier conversation that that's not set in stone, that you're not necessarily going to raise our taxes $1 per thousand of assessment?
Well, if I'm a good negotiator, we're not. But no, in all honesty, I did that based on what our legal notice had to come up and find. We had to look at what I thought. So I looked at what EMS gave me, and I paired off what I could in a short period of time, and I came up with maximum of $362,000. So that made the tax rate 99.9. But
It's a lot.
It's just like any budget, you know?
Well, right.
And what happens is, Ms. Mender, is I will have to sit down with the emergency squad leadership and figure out where we can save some money off of the proposal that they gave us.
I have to say too, I'm disappointed they're not represented here tonight.
But I had asked him to come, so I think he's
I
on
know
a
it's
run
not
or
good.
something like
Well.
that. So it's,
Oh, that's
you
cool.
know, that's the worst case scenario.
Okay, all right.
Okay.
Well, that's what I was wondering. Now, if we have this budget line and it's for 300,000 and they don't need it, and we only give them, it's going to be by contract? Is that how it works? So it won't matter?
Bob?
Yeah,
Okay.
we're authorized to pay for a service, a set dollar amount. That's what the contract has to have. So
Okay. The only other question I have is that in one of the articles I was reading about one of the other districts being created, the way they kind of explained it was because they were currently supporting the EMS via the general fund.
Yeah.
And now they were creating a district, that there was a bit of an offset in those taxes because now they didn't have to go so deep into your pocket to get the general fund monies because they're going to be in that. Would that be true here as well, do you believe?
Well, yes. We would have an $80,000 offset, so it wouldn't be 362, but you're already
No.
paying 80,000, but it's coming
Right.
from a different pot. It's the same tax, it's
Right.
coming from a different pot. This EMS tax will be a tax all by itself.
Right,
Be
right.
separate.
So consequently, someplace in those numbers, hopefully my other taxes may go down a tad because
Yeah.
that would be the goal.
Also, the pay rate is the same for us, North Warren. Everybody has budgeted for the same pay rate for the personnel.
Right, which is why I was surprised that ours was so much higher. I think even Stony Creek's was only, their public hearing showed it to be, I want to say 66 cents per thousand. And
Well-
like I say, like Bolton's was like 22.
Well-
You can't compare us to Bolton.
That's all based on assessed value.
Right,
Okay.
I appreciate that.
When people stymie our growth in the community, when we can't attract people to come in and build in our community, this is what happens to us. I've said this 100 times about the sales tax. If you knew the amount of sales tax our surrounding communities get compared to
Oh.
Warrensburg, which is the busiest, second busiest town. I mean, look, we have 2 pharmacies, we have 2 grocery stores, we have 2 meat stores, we have 2 of this, 2 of that. We don't collect anywhere near. There's nothing I can do about that because we stymie growth in our community sometimes.
That's true.
So,
I understand that.
but
And may I
Yes.
ask you just one other question?
Yep.
During the earlier conversation, is this because the EMTs will now become actual employees with benefits? Is that one reason the budget is so big?
our model is not for them to become employees of the town of Warren.
Right, I appreciate that,
So
but you
our-
were saying how now they're mostly
Our
independent
model, well,
contractors.
in Lake George took them on and made them employees.
Yes, they did.
That would change some of this. Then the town would collect all the money.
Right.
And then we would divvy it out through a budget process.
And I would imagine that would be even more expensive. I would have to
I
think.
don't think it'd be more expensive.
You don't?
A lot more work for somebody.
All right. Well, thank you, gentlemen. I appreciate it.
Corey, you want to address we had an issue about, you want to come up to the microphone? I have a couple questions for you.
Come on, Corey, I'll put you on the spot.
So. The question was asked of all the runs that we do in the various communities. What's going to happen if the town of Warrensburg ponies up this kind of money for the service? How are you going to assure the residents of the town of Warrensburg that an ambulance would be here 24/7 to answer our calls?
Right. So Warrensburg has, being so centralized in the county, Warrensburg has been leaned on a lot by surrounding agencies for mutual aid. I know that like George, Chester, sometimes Bolton, Stony Creek. Stony Creek is all volunteer, but they have trouble manning their ambulances. And so oftentimes we get called to respond to those districts. In the recent years, if we go back 3 years, our call volume was over 1,100 and we were transporting probably 600 to 800 patients a year on average. And what we've seen in the last few years is we've seen a big influx in call volume. Last year, I think we were at just over 1,400 calls, transporting about 1,100 patients. Now, the difference between calls and transported patients is lift assist, people who call the ambulance and then we sign them off if they decide not to go to the hospital, medical alarm activations that are unfounded. So those are a lot of those calls that we get throughout the year that make up that difference. What Warrensburg has done is we've put on a second ambulance during peak hours, which nobody else in the county is doing or has done. I think the ambulance services in the lower part of the county are trying, but we put on a second BLS ambulance, basic life support ambulance staffed with 2 EMTs. And that ambulance is available. It fluctuates, but right now it's available from 10 a.m. to 6 p.m. And then we have an ALS ambulance that's 24 hours, 7 days a week with a paramedic or critical care technician and an EMT basic or an advanced EMT. And that's on, like I said, 24/7. And that's how we've addressed being able to have an ambulance in our town anytime someone calls. Now, in a perfect world, we'd be available every time. But obviously, if we get 3-4 people calling 911 within a short period of time, we just don't have, nobody has that availability, no matter where you live. You know what I mean? The services get depleted. But I will say that Warrensburg has been responding to 94% of all of our dispatch calls. Our second ambulance is handling 25% of our total call volume during those 8-hour periods, 7 days a week. That's how we're addressing it now. When it comes to, and I think Kevin mentioned, like Stony Creek and Thurman and stuff like that, how we're addressing that. Thurman is a delicate subject because Warrensburg, this was before my time, but Warrensburg assumed the town of Thurman, and I don't know all the specifics with that, but for a contractual amount of $50,000 a year to cover the town of Thurman. And, the reality of it is it costs a lot more than $50,000 to be available. But, and we've been working with Thurman with that. I think I don't have a genie in front of me, but I think in a perfect world, if we're going to continue servicing Thurman and we're going to continue servicing Stony Creek, I feel like it's only fair that they are also paying the same portion of services used for their towns, right? Like, it's not fair for Warrensburg to pay for us to have a service that's going out of town, right? Now, I think, there always needs to be a first step. And, this is probably the first step. Stony Creek is paying a mutual aid agreement. So they're giving us money every year to help provide staffing and supplies. I think it's $10,000 a year, obviously, but that's for an advanced life support agreement. They have an ambulance and they have a crew that tries to respond. So they do handle a portion of their own calls. And like I said, Thurman's handling, or Thurman pays us $50,000 to cover their town. So that's how we're working it out to make sure that we're available. We've also, like I said, having that second crew being able to be available. What that's done for us is allows us to put on more staff. You've mentioned staffing. So we do have a lot of paid staff providers, but it's hard because we can't afford to pay people benefits, health insurance, dental, vision, retirement. There is none of that, just because of affordability. So the people that we do get, we've been fortunate. The people that are here that work for us are because they love the area. So, we've been very lucky to have them while we do. And that's how we've been able to roll second ambulances, we'll call it roll, but respond, for mutual aid calls. Like we had 2 calls that went out last night after midnight, and we got 2 ambulances off the floor within 15 minutes. So we've been lucky to do that. By having more staffing, we're keeping them from going to other agencies. We're keeping them here. And so they're available to respond to calls as well after hours.
Both those calls are in the town of Warrensburg last.
Yep.
The amount of calls out of the health center, what's it averaging per month?
Averaging per month, I would say, and don't hold me to this, but off the top of my head, I would say 50 to 60 calls a month out of the health center. On average, usually we see about, I would say, between 400 calls a year, usually from the health center. Obviously sometimes it's high, sometimes it's low. In the summertime, I think we see more patients out of the health center. But yeah, so that's been a the health
But that's
center
a huge increase.
is a huge increase. Yeah. No.
Any other questions from Mr. Black?
How long is this contract in place then with Thurman? You say that you're taking your first steps, but don't these contracts come up annually? No?
Right. Well, the contract is an auto renewing contract. And like I said, it wasn't, I didn't sign it. But it's an auto renewing contract, and I met with them last year, and I was supposed to meet with them this year. And I haven't met with them yet this year, but for an increase. But it's also that same sort of thing. I think it is some sort of tax district is necessary if they do want an ambulance service that's readily available, because it is a lot of money, but it costs a lot of money to be available. Our 24/7 ALS crew, just that one crew, just the staffing that we have right now, before we have add insurances or paid time off or anything like that, it's like $350,000 a year. And then our second crew is another $100,000 a year, $110,000 a year, and we've buffered that a little bit with accepting transports from Glens Falls Hospital. So if they have patients that are going back to Countryside Adult Home, or if they're going back to the residence in Warrensburg and stuff like that, we take them. That's added income that we use to help fund that crew, so they're available
How does that get funded? When
by
you say
billing.
by billing insurances.
Right. Yeah. But I mean that's only a small part, because you figure our billing revenue is $500. Last year, our billing revenue was $509,000. By having our increase in call volume, we've had an increase in billing revenue, and now it's $509,000. But when we have staffing, which is $350 plus $100 for the second crew, so we can respond to all of our calls, then you figure an ambulance is, I was pricing ambulances the other day just so I can get an update on pricing. They're $180,000 to $230,000 per piece of apparatus, depending on what we buy. Now, when I came to Warrensburg in the end of 2019, I think it was, we had one ambulance that was parked in the back of the garage that wasn't running. When we had another one that had 80,000 miles on it, we had one that we were dumping money into every time we rolled it out of the garage. It seemed like it cost $1,500. And so fortunately, we were able to trade the one that had 80,000 miles in, and we bought a Sprinter. I don't know if you've seen that Sprinter van. A lot of patients complain about it because it's so small, but I like it because it's cheap to operate. And we are able to have the Sprinter, and fortunately, we bought a used ambulance from Johnsburg. And so we've been working our way up to get these apparatus, but those are fortunate things that happen. Those aren't things that we can plan for in the long term. You know, we got an ambulance from Indian Lake that had 50,000 miles on it. We got it for pretty decent price. But we can't always plan on those things. We can't plan on always buying Indian Lake's leftover. We can't plan on, you know, being able to do that sort of thing. And so when we look at having to buy a new ambulance at, you know, let's be conservative, say 180,000, how do we plan for that when our billing revenue is taken up pretty much entirely by paid staff? You know, that doesn't include the electric bill, which is like, you know, $300-400 a month, and the fuel bill that we've been, you know, we get our fuel through the town, so it's still a lot less, but our fuel bill runs probably, I don't know, Kevin, if you have that number in front of you, it's like $1,100 a month, our fuel bill.
Yeah,
It's like $1,100 or $1,200 a month. All of our medical supplies have either doubled or tripled in price. And what the pharmaceutical companies have done to us is, instead of being able to buy, you know, we're a small company, so I don't necessarily need a whole like box of 12 vials of medication. I only need 3 or 4. But now they're making us buy a whole case of them. You know, they're not selling them by the vial, so our costs of medications have gone way up. I mean, literally everything that we do to try to provide the services, and this is like this everywhere in the world, that has gone up so drastically in price. You know, we've been able to sustain a lot in part by our volunteers. We have a lot of volunteers that come out and help. We had 2 volunteers last night roll our second ambulance. It was me and Jack. We were on the primary crew. We were on the duty crew, and we had a volunteer with us. We got the second call right after we had the first one. We had a volunteer driver go to the station, and he picked me up, and we went to respond to the second call, and we split crews so we could handle it. So we were lucky to have those 2 volunteers. But we don't always have volunteers. You know what I mean? Like that, our volunteers they probably save us about, I think the number I gave Kevin the other day was like $46,000 a year roughly in staffing that it saves us. But that doesn't, volunteerism ebbs and flows. We'll be heavy now, and then people get busy, or they move away, or they get jobs, or they lose interest, and then we're desperate again. You know, so that's not always a super reliable thing to count on.
And it's the same thing with per diem EMTs as well. They come in waves as well. So if someone comes to us and then they get a better offer at Westlands Falls, then they up and leave Warrensburg, and we have to hire another per diem. So I think a good way to look at it is, by adding benefits, we're keeping professional providers in our town that can help make a difference and help make sure those 2 ambulances get off the floor, and helping us compete with other districts.
Yeah, a lot of, and then that was one of the big factors of trying to do the district, is to try to make this more than a job, but to make it be able to be a career for somebody. You know, it's one thing to have a job and you get an hourly wage and you go home, but it's another thing when you have a career and you have retirement, and you can have health insurance, and you can have paid time off. Like, we don't have that, and we're trying to hire advanced life support providers, paramedics and critical care technicians, and we're trying to hire them. And oftentimes the things that I get when I'm interviewing or I'm asking people to come work for us is, well, what do you offer for benefits? And I'm like, well, I don't. Well, North Warren's going to be offering health insurance. I'm like, well, we can't afford that right now. Well, like, Georgia's offering health insurance. I'm like, well, they can go work at Wilton or Malta or Clifton Park. They offer health insurance or paid time off. And I'm like, retirement. I'm like, well, hopefully we'll be able to do that, but right now we can't, and that makes or breaks it. And, you know, we're short right now. And luckily we have a lot of dedicated people that live in town. Like, I live in town, and I do not let Warrensburg go without an advanced life support provider on the ambulance. I was on duty when I got out of paramedic class on Friday night at 6 p.m. and I got off the ambulance this morning at 6 a.m. I was on duty that whole time, because we're short staffed. And if we don't have people, we don't have people, you know, and I'm not gonna let the ambulance, if you call 911 and you're having chest, I'm not gonna let, you know, if Lake George doesn't have an ambulance, then you're waiting for Queensbury, North Queensbury, Bolton maybe, you know, can't let that happen, you know, and the idea is that we could be able to bring people in from out, you know, now we could be competitive with, you know, these other larger companies. You know, when you can work for let's say Wilton, who does a lot more calls than us, or you can work for Warrensburg, who's a small town agency. You're not doing as many calls, and you can get the same benefits and the same pay. You figure paramedics going to college or school for 2 years, and they have somebody's life in their hands, at any given moment. It's a lot of responsibility, and people aren't willing to do it for $20 an hour anymore. It's a lot to maintain, a big certification, to maintain a lot of continuing education and a lot of responsibility, and the demand is a lot higher. Everybody needs people, and so it's like the housing market, and Linda will be able to relate. It's the difference between a buyer's market or a seller's market. And right now it's a buyer's market because paramedics can go anywhere they want, whoever's paying the highest. And fortunately, we've got, I don't mean to brag, but we've got an incredible department. We've got a lot of great people, but for some quality providers, it's the bottom dollar that matters. It's what they're getting, what they're able to, are they putting money in their retirement accounts? Are they getting health insurance?
Are you signing contracts for your employer, your important people? Are they promising to stay for a while, or is it still a game all the time about being attracted to it?
So right now it's a game, right?
This goes through.
So if this goes through, I feel like, pretty much I've been doing a lot of research, like retirement should be contributed after you've had a year of service. Like there has to be something that we hold on to, right? So I think I could get advice from Kevin or from any of you guys, as far as like how would be the best way to structure it. Because I don't think you should just throw all your eggs in one basket either. But I think after a year of service, you're eligible for a 401k or whatever the retirement plan is as a match. The state makes, I don't think it can be any longer than 90 days for retirement or for health insurance. I think it's 90 days is the max. But we work right now through Kena Staffing. We get ours. Kena Staffing handles the employment part of it. We have employee agreements where they acknowledge, that they're working for X amount of pay per hour, under whatever the benefits are, none usually, that they have. But we've tried to steer away from actual contracts, unless they're doing a service, if they're the operations manager, if they're, there for a specific purpose.
Any other questions on the EMS district? Please go on.
Do I get to move, or do you want you asking me the question?
Is it a question for Corey?
Well, it is, and then,
Okay.
Linda Marcella, 5048 State Route 9, Chestertown, but it's in town of Warrensburg. So if I understand correctly, it's 362 that approximately the budget would be for this year, or that you proposed.
That would be the max.
That'd be the max. And with that, we would not be paying the 80,000 out of general fund. Okay. So Corey, what is your total budget? So we're looking at 362 approximately being from the district.
Right.
And then will you be looking to get the 50 from Thurman?
Yeah. The 50 from Thurman doesn't change in that I'm bringing up the amount of money that we're doing for Stony Creek. So, that I'm hoping will come up. It will have to come up. If we're leaving this town, if we're providing services, has to come up. I feel like they deserve an ambulance, but what are we gonna do? But yeah, so, our total budget, I think is.
It's $1,054,823.
How much was it?
Well, $1,054,823.
I think that we had dropped that to right. It was
Well, we've dropped it.
Right, yeah,
This part of we.
right, yeah,
And we're still gonna look it over
right.
further.
It's a lot of money. I'm not gonna say that it's not, but when we look at cardiac monitors, $35,000, the stretchers, $30,000, the power lift that loads the stretcher in the ambulance, $28,000. When you look at every piece of equipment, our stair chairs that we use to carry people out of people's houses, going from the second floor or down the steps, that's like $5,000 or $6,000. Those haven't been replaced in 7 years. So if we're gonna say we're gonna get new stair chairs, that's $18,000 that we're gonna need to use to buy it. Like, our monitors are 5 years old. So yeah, it's a lot of money, and I get it. It really is. But when we're talking, we're doing 1,400 to 1,600 calls a year, and we're handling 94% of our total calls. And right now we don't have a plan to replace ambulances. Like when they're up and they have 100, an X amount of 1,000 miles, and we need to buy a new one, we then figure out how are we going to do it? How are we going to afford it? We take a loan out. We pay a loan. So a payment on an ambulance is $1,100 to $1,400 a month. We finance it for 10 years and hope it lasts that long. We've gotten by, but with paying staff so much, we're in a different era now. We're in a different time now. Staffing costs so much more. Something's going to have to give, and that's why we've been able to get by having, Indian Lakes ambulance and buying Johnsburg's used ambulance and having the Sprinter. We've been able to get by, but it's not sustainable. Like me being on the ambulance from 6 p.m. on Friday to Wednesday morning is not sustainable. I don't want our department to, if you're having a heart attack, I don't want to be putting a cardiac monitor on you that's 10 years old because I can't afford to buy one, that they're not servicing and they're not doing anymore because it's $35,000 and multiply that times 3, and that's not just a one-time purchase. That needs to be done every 7 to 10 years, as with the stretchers, as with we have a mechanical CPR device, $14,000, to do CPR. We may not need to, that could be something we could say, oh, well, we don't need a mechanical CPR device. We can do that by hand. But anybody in this room that's ever done CPR, you can't tell me that the first compression is good as the last when you've been working a cardiac arrest for 20 minutes. And yeah, you might have, firemen there to help you and more squad members there to help you, but not always. Sometimes it's you and your partner and somebody who heard the pager go off, So this equipment is super vital, but it's also super expensive.
Who's doing the collection
Collection of what?
from insurance?
Emergency Management Resources LLC. They're called EMR. They're a company that does a lot of local. I don't want to name specifics, but they
do all the squads in Warren County.
Okay, I know they do a lot. I didn't want to misspeak, but they do a lot of the squads or all the squads in Warren County.
And what do you know what percent they collect?
10%.
No, not what they get paid. What
Oh.
percent of what they file for do they collect? Do they keep going after it until they get it?
They go after it until they get it. Yeah, and so there's no such thing as soft billing anymore. Historically, people would say we do soft billing and we bill people who have insurance and not people who don't. We can't do that anymore. We have to bill everybody fairly, but we do have hardship plans. We accept payment plans, and they will go after it. They go after people like some people's insurance plan will pay, let's say you took the ambulance and your insurance company would mail you a check. And then they get notified and then they go after and they say, Mrs. Marcella, we know that you received a check. Please forward that to this address. And they're on top of it. What's been a really big hit to us in recent years is high deductible insurance plans. So, especially in the beginning part of the year, we see a really big dip in the monies that we're receiving from insurance because that's when everybody's paying their deductibles, right? So the insurance companies aren't paying out. That's the patient's responsibility, and you don't always have $1,400, $1,500, $2,000 to pay for an ambulance. And so we usually see a dip in the first quarter of our billing revenue because of that. But yeah, as far as the number goes, I want to say 50-60% of money that we collect of what's billed. Now, I know that doesn't seem like a lot, but when you figure Medicare, Medicaid patients have adjusted rates, so we might bill $1,900 and then we have to adjust that to $600 and we might collect $350, that's what eats up a lot of that number.
So I think to the town board, two things are critical. I think the public could be concerned that once it's in place, it can go crazy. And you compare it to a water district, well, you have some control over the water district. So I would say you basically have the same thing, control over whatever budget's brought to you. You know, if the highway department brings you a budget, you approve it or don't approve it, fine tune it and that sort of thing. I think you would do the same thing with this budget. I would think if it was going to increase, I would think they'd have to sell it to you why it needs to increase. And then the other thing, I just think that it's critical that we make every effort to get those others around us to pay their fair share. That's what I think.
Thank you. Anybody else on the EMS budget? Or in the EMS district? You know, a couple of things that have happened to all of us. A few months ago, before we changed folks, and we were paying maybe $600 a month for fuel. Fuel costs now are $1,200, $1,300. You need to know that. You need to know it's going to affect you this winter. Fuel oil was $2 a gallon. It's $5. Workers' comp, their workers' comp cost is going up next year, whether they've had an accident or not. Their workers' comp cost is going up. I just got the new comp numbers for 2023. Maybe they didn't have any accidents, but it still is going to increase. All ours are. Price of electricity is skyrocketed, whether you shut the lights off or don't shut the lights off. So that organization is facing the same concerns as every organization. I'm going to work with them to try to pare the budget down a little bit more. I'm going to help him create reserve funds so we can put some money away to purchase equipment in the future that he needs, to do a little more savings plan for him. So I agreed to help them with this, but I got to be realistic with you. It is what it is. If you don't do it, you may not get the service. And you're all going to be in here clamoring to the town board about you need to pay more. We've been very fortunate. We have worked very, very well with the leadership over there. And, we continue to work well with them. I continue to look at other avenues. Like I said, I'm going to talk to Hudson Headwaters. See, I'm glad I got the numbers tonight. The amount of runs that come out of the health center. Health center gets a lot of federal dollars. So I'm going to talk to Dr. Slingerland and the CFO and see what we can do to see if we couldn't get a little bit of that to offset our squad costs, at least here in Warrensburg. I don't know what they do. And I'm concerned about the system. I told you, had the state of New York let us do a countywide system, even though some of the squads balked at first, you would have had a workforce on the county payroll. They would have had vacation time, it would have been civil service employees, would have got a decent rate of pay, and then they would have been scheduled into all the squads. Now all the squads are forced, as Corey said, you're competing. And I've said this before. When the town of Queensbury can raise their rates $2, before people would clamor to go to the town of Queensbury to work. Well, at the time, I think it was $21 an hour. But all the area squads right now have come to a $25 an hour rate, and 18, I believe, is the other rate. Now, I won't say in the future that North Warren, Chestertown, or Horicon don't reach out to us and say, can we put our arms around this and make this work more feasible for the towns to do joint districts. That's been broached to me right now. I wanted to get through this first phase first. And like I said, Corey and I will sit and try to negotiate a contract where we make sure that the residents of our community have the best coverage possible. So whether you vote for it or don't vote for it tonight on a town board level, something's going to have to be done. Money's going to come from somewhere.
And that's kind of where I was going with that as being the first step. Like I agree when it comes to Thurman, when it comes to Stony Creek,
Yep.
that's a discussion that needs to be had, and then we can say, this is what Warrensburg has done to ensure coverage. If you want to ensure coverage for your town, then this is the steps that need to be taken, you know.
For anybody that doesn't know me, I'm Jack Bartlett, I'm Corey's vice president. I'm from the town of Chester, and last night they also went a public hearing for their tax district. And I voiced the same concerns as a taxpayer in that town as you are all concerned with this evening. The only thing I want the board and the town to think about is in the town of Chester, they have an emergency squad that does not provide the coverage that the residents deserve. And they just raise their rates and they're working on their payroll and, you know, how do they attract people to come there? And now the town of Chester has boosted from $180,000 to now they're giving $260,000, I think, to their EMS. And that squad is not showing what they can do to support the town. And I voiced that concern and their tax district went through, I don't want to say unfortunately, because ambulances need to roll, but that squad is not getting off the floor and they're not serving the residents. The one good thing and why I leave Chestertown and work in Warrensburg and spend the majority of my time in the town of Warrensburg now is because we've come to show that we care about the residents. We're getting off the floor. We're there for you when we need you. We're leaving our houses at 2:00 in the morning when we're not working to make sure that there's an ambulance there for you when you need it and that you're not waiting for Lake George, you're not waiting for Bolton to come over. And that's an important detail to me that the residents and the board need to be aware of, is that someone is there when you guys need it the most.
Thanks, Jen. Anybody else? Any questions about the ambulance? Please go.
Jim Hull. I'm just, when he said that they do 1,400 runs a year, that's not for the all residents of Warrensburg, right?
That's our total amount of dispatched calls.
But they're not all for Warrensburg residents.
They're not all for
Okay.
Warrensburg.
Thank you.
Anybody else? Nobody else? Okay, we'll close this public hearing on the ambulance district. All right, we'll move on. Next item of business, approve the minutes of the July 13th meeting. Motion by Supervisor Larkin, or Supervisor. Councilman Larkin, second. Councilman Alexander, all those in favor?
Aye.
Brian, I think we'll waive the reading of any reports tonight. There's a lot of reports. We have them. If you want a copy, you can see the town clerk and get a copy. The one thing I do want to bring up about the youth is congratulations to Warrensburg girls Middle League softball team. They won their championships this year. And they're coached by Mike Curtis and Corey Olden. And also on the boys side, the Warrensburg Volunteer Fire Company boys Middle League baseball team, they also won the Tri-County League championship. So I think and they're coached by Lenny Baker. I think that's the first time in my being around that's ever happened, that the boys and girls both won the Middle League championship. So I thank both the coaches, and I believe the fire company will do something for them. So no communications. Bob, on the energy services discount electric bills recommendation?
You asked us to look into things.
Yep.
Have this one paid for last, sorry. Thank you, Danny. I'm failing in my job. They had the one-page form at the last meeting, and we said we would look into it. The one-page form incorporated a much longer contract, and we did get a copy of it and reviewed it. We had some concerns that we talked about them. But the bottom line is we don't see a reason for the town to not, if they want to proceed. It does seem like you will get a discount, whether it'll be the full 10%. It's hard to tell. It's based on, it could be that much or it could be less depending on formula in it, but it won't go up. There is something about a subscription fee that is in the contract, but we grilled them about that. They said that what will happen is if it does get approved, that Kevin will get a call and he'll get a contract, and they will explain and confirm that there will be no subscription fee. It's a box to check in, and we will review that to make sure that that's the case. So if you want to do it, we don't see a legal reason not to. It looks like it might save you some money.
Board, what do you want to do?
Move forward.
You make a motion? We have a second? Second by Rich. Discussion? All those in favor?
Aye.
Opposed? Carried. And Flatley Reed, we're moving ahead with that application. I don't think we have to do anything on that tonight. No comments on EMS district, no more? Then we'll close that public hearing. Discussion on forming the district.
I'll start, I guess. I was dead against it, starting, but tonight's dialogue got me thinking differently, I think. And again, I was with Jim's corner a little bit, trying to translate a little bit of same verbiage with the library and EMS, but it's totally different because EMS, they save lives. Library, not so much. It's just there. They need our help. That's for sure. It's obvious. I think there's a lot of pencil sharpening in your budget. Here's a man that's going to help you with that. I guarantee it. The formula that was used to come up with the numbers, the town tax going down the town general fund going down $80,000 will translate to something. Be a few cents or something. That'll go down. We know that. With the ambulance district, I'm looking at maybe $700 on my properties. Does that make me happy? Not really. But what are you going to do? That's something we have to do, I think, because they need the help and we want their services here. And that every budget you do could be addressed with the board and help people like Kevin, accountants can look at these things and say, this is where you need help. And like Kevin is the man to help you with these issues a lot. He will. So I guess all in all, at first, my questions were to Corey were what it was going to change. What was going to change with another $280,000, $300,000? What was your business plan to have this, going from there, for the revenues you're making for Billy plus this? And you answered the questions. I'm glad you showed tonight because you guys were busy, but you did a good job answering the questions. I think you sold my questions anyway. That's all I got to say.
Councilman Rounds?
Well, I think it's a very important service, and likewise, we all love the fire company. We're thankful for them, but we have fire insurance and the building is just a building if it burns. So, but we're talking about people's lives here. So it's very important that we do something to support this. I myself, I'm going to be on you like stink on a hippie if I start seeing chrome wheels on all your ambulances and everything, So it's obviously you guys do some fundraising now. The fire company always did things like that, and everybody does. I mean, anything you can look into to help yourselves and help us and not get us hung from the bandstand on this, And I'm for moving it forward, but we're going to see what happens as a petition level. That's obviously the taxpayers have this option to fight back a little bit on that, and we'll see what I'll be having my ear to the ground on that.
Rich?
As already has been stated, I think there's a huge amount of concern, and my biggest holding up thought would be how much of your budget is going to fluctuate from one year to another. And I'm aware of some of the projects you have in the works, and I think that the way you approach what you do is very professional. But when I think about, you're starting out with a $360,000 budget, my concern is there's no tax caps on your organization. We might be looking at $500,000 next year.
Excuse me, there is a tax cap.
And is that the 2%?
Yes. Well, whatever the rate is.
Again, the fluctuations of your expenses, the high cost of the various things that Kevin has mentioned, like fuel and paying your staff. It's not an easy decision to make for anybody.
Right.
But nobody can take away the vast importance of what you guys do. I'll leave it at that. Thank you.
Okay. Well, I put forth the district because I'm in favor of it. I understand people's concerns. Certainly, I'm going to work with the organization to make it better, to get them on stable financial grounds. You know, I can't sit here today and tell you that we're gonna raise 362 this year. I can't. Not until I spend more time on some of the expenses. We may have an avenue to cut some of the expenses. I too think a lot of the proof will be in the pudding of the contract we draw up. And that's something I'll sit with Corey and Jack, and we'll work on a contract with Bob. But we have to be cognizant that we're here representing the town of Warrensburg. And understand what's gone on in the past with different things, but we're here tonight to represent the people of the town of Warrensburg. So it's up to all of us to come up with the best deal for the people of the town of Warrensburg. Be conservative, understand any tax increase is not welcome at this time. When you look at the economy out there, it's gonna pose a problem to a lot of people. I think they understand that. Hopefully with some creative budgeting, as I told Corey when I sat down with him, I'm gonna be here for a few more years. We're not gonna raise the budget next year. We're gonna figure a way not to raise the budget. I've already gone to at least one organization to try to find some funding for them for the building they wanna do. So we understand that's coming. As I told you before, I'm gonna work with Hudson Headwaters to try some funding to offset the cost for Warrensburg. So we will try every avenue to keep this tax rate stable and at a reasonable cost. But you people can help by writing your senators and writing your congresspeople and telling them that the Medicaid, Medicare rates need to fall in line with what it's costing these EMS folks to make runs. They don't line up. And last time that happened, I wrote letters. I got no response from Senator Schumer. I got no response from Senator Gillibrand. I did hear from Congresswoman Stefanik's office. But you people need to help us. You're paying the brunt of this. You're paying it because the federal government is basically turning their back on people who live up here. Whether you like it or not, Republican or Democrat, when you get your fuel oil bill this winter, that's the same thing that they're going to pay. And I look at those fuel bills every month, and I can tell you right now, we've seen about $300 to $400 to $500 increase in the last 6 months. That's just fuel. So they need help. We need help. You need to let the people in Congress, because it does help when you write letters. Usually they get back to you. It's a shame now that some still hide home because of COVID. But anyways, you should write it. Let them know the plight you're going on up here. Let them know that this is pushing our taxes up because they don't take care of it on a federal level. Write Dan Steck. Write Matt Simpson. Ask them why we couldn't get a countywide bill passed in the state. It's time to hold people accountable. You know, and I'm not saying that would have solved all the problems, but there's strength in numbers. The more people you bring into the fold, the better off your workforce can be sometimes. So those are the things. We need help. We need help. You people need to come involved. You come tonight. How many times have you written the state to ask them, how come you didn't pass a bill? Or how many of you ever even know that the EMS service gets peanuts on a dollar for the job they do on the Medicaid and Medicare? So you got to help us. You got to write these letters. That will shake them up. I guarantee you. They'll be calling me up saying, well, what did you do? Because that's usually how it works. But that's what you got to do. You've got to, we need help. The squad needs help. We're going to do everything possible to minimize this tax. People know me. I don't like to put these taxes in. I'm going to work with Corey. 362 was the top end of what we came up with. I'm sure it'll be a little bit less than that. Not a lot, but it's gonna be less than that. You know, as far as Mr. Hull's suggestion about making them town employees, well, we'd have to study that too to see what that would add to your district. You know, what that would add to your town tax rate. There's more control. I believe we'll have control. It'll all be in our contract, how we write our contract with the EMS. And I think dealing with those two gentlemen, we can come up with a good contract for the town. So I'm going to support it. So I'll ask Pam if you'll ask for a voice vote on forming an ambulance district.
We get a move in second.
Huh? Oh,
Did
we
get
need a
move
motion
in
to
second?
move it. Motion by John, second by Rich to move it forward. Okay. Sorry about that. It's getting late for me. Go ahead, Pam.
Yes.
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 Yes. Okay. Thank you, Corey. We'll be in touch. Okay. And thank everybody for your comments tonight. I appreciate that. Okay. Just so you know, we have a lot of projects on the horizon. The water transmission line project will start in a few weeks. That should be going on in September. We did get partially grant funding for that, and the rest of it will be paid for out of our water fund. We are rescinding the Resolution 90, 2022 to apply for CFA funding in the amount of $70,000 for the master plan. We were late and they really want to complete it master plan. We may apply for the funding next year. So somebody make a motion to rescind Resolution 90-2022. John?
I'll second it.
Brian? Discussion? All those in favor? Aye. Okay, I need a bond resolution authorizing $575,000 in serial bonds of the town of Warrensburg to pay for the cost of reconstruction of sewage lagoons requiring the removal of accumulated sludge and authorizing the issue it up to $575,000 in bond anticipation notes of the town of Warrensburg for the same purpose. This is a long anticipated removing of sludge from the lagoons. The lagoons were put in 1992. We tried to do routine maintenance on them. There's just too much sludge in the bottom of the lagoons. The best practice for us now is to get them all drained, all 4 cells. And we have a company who bid $937,000. They'll come in. They can complete the work in about 30 days. That way that wastewater treatment plant will be in great shape for the next 30 years, I'm hoping. Also, on certain occasions, we get a little, a test that goes out of whack. And the reason for that is the amount of sludge in the lagoon. So a new motion to issue the bonds of $575,000. Motion by Rich.
I'll second it.
Second by Brian to issue bonds, $575,000. Discussion. All those in favor, Pam, you want to call a voice on this one?
Yes.
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 Yes. The balance of this project, we will use the ARPA funds for. We have $404,000 of ARPA funds. We will use that for the balance of this project. Resolution request from the Chamber of Commerce to approve sponsorship of a major local event, world's largest garage sale, set for September 30th through October 2nd, and waive the permit fee. Motion by John,
Yep, second it.
second by Brian. Discussion, all those in favor? Aye. Opposed, carried. Resolution request to allow the Warrensburg Chamber of Commerce to use 3797 Main Street, Town Hall, and Richards Avenue parking lot for world's largest garage sale, September 30th through October 2nd. Motion by John,
Second it.
second by Brian, to allow the chamber to use town-owned properties. Discussion, all those in favor? Aye. Opposed, carried. Resolution request from Warrensburg Central School to use recreation facilities the 2022-23 school year. There have been many events they would like to host there. Fall sports will start on August 22, 2022. A certificate of insurance has been provided us. And now that they don't do field hockey anymore, they perhaps will host some home soccer games in our facility. Cross country likes to use the facility, so a lot more activity from the schools. So motion to allow that. John? Second by Rich. Discussion? All those in favor? Aye. Opposed? Carried. Resolution requests support the 250 anniversary American Revolution Committee. This will be a collaboration of members from Warren and Washington counties to plan area events, ceremonies, activities, and celebrations. Warrensburg Town Historian Sandy Parisi to be the town's liaison to the committee. Motion by Brian,
Second.
second by John. Discussion? Sandy, did you know that? You do now. Okay. All those in favor? Aye. Okay.
You gave it last month.
The last thing
Get
is
ready for this one.
something late that came in. New York Ford is accepting grant applications for downtown revitalization initiative. I worked with Warren County. They called. We went through a area of town of Warrensburg they thought would be our chances are good of getting this funding. So town of Warrensburg, we signed on to work with Warren County on this. We have a target area that runs from Richards Avenue all the way up to probably just beyond maybe John Hall's old law office. But anyways, the target area is the county's going to work, apply for funding. And there's various things you can do with it. They feel very good about the application and went in today. So I need a motion to approve what we did. Motion by Rich,
Second.
second by John. Discussion? All those in favor?
Aye.
Okay, we have some water rates adjustments tonight. 264 River Street went from a family residential senior to a family residential, was for $48 to $195. 25 Commercial Avenue went to from two buildings, no service, to family residential, and went from $390 to $195.04. And 30 Stacy Street went from a buildable, a single family to a vacant lot, went from $195.04 to $100. Net change is $143. I need approval of the water rate changes. Rich? Brian? Discussion, all those in favor? All right. We have a couple of budget transfers tonight. We're taking $35,000 out of appropriate fund balance and we're putting it into parks. That $35,000 paid for the fence around the tennis courts that hadn't been replaced in years. The next, we're waiting for the company to come in and put the pickleball courts in, and that project will be out of the way. On the cemetery, we're taking $10,000 out of appropriate fund balance. We're putting some in, $9,000 in contractual and $1,000 in employee benefits, cover our expenses there. And then we're taking $23,458.90 out of insurance recovery for the highway department. We're putting into insurance recovery contractual, and that covers the cost of repairs to a truck that was damaged during a windstorm this past winter. So motion to approve the budget modifications.
Oh, okay.
I'll second.
Second. Okay. All right. Comments from the floor? Anybody? Yeah, I'll get to warrants. Any comments? None? Okay, that's good. Resolution to pay warrant number 8 in an amount of $282,412.87.
So,
Oh, Rich?
Second.
Second, John. Discussion. All those in favor?
Aye.
Okay. Sure there's nothing else you would like to discuss? Please do. Come up and state your name for the record.
Susie Matzner, I'm here representing Richards Library. Please don't jump all over me. The library is a society library. I'm the secretary of the board. And I just wanted to talk about what we're doing. We have absolutely no plans to raise the money that we're receiving right now. We are doing well. We have a wonderful new director, Shelby Burkhart. We've got a variety of programs. We have a lot of people coming in and using the library. We are buying new books, new DVDs, and we've got programs. I left a copy of our calendar. Every Friday, we have take-home crafts for people to take home for their children. We have somebody working 2 days a week in the afternoons, Tuesdays and Thursdays, who's available to help people with their tech problems. If you're having a problem with your computer, bring it with you to the library. If you've got a laptop, they will help you, or he will make arrangements to come to your house. He's done that as well. Wonderful young man, great addition to the library staff. Because COVID restrictions have been reduced, because right now we are low incidence. We've had programs in our downstairs in the Jeffrey M. Levine Community Room. So we're doing programs like coding robots. We have relaxation hours every Wednesday afternoon. We're doing story time. We're going out and we're having story time in the library as well. So I just wanted to let people know. We also have had a very large increase in the number of people that are either sitting outside or parking along the front, in front of the library, using our internet because of the various storms that we've had. When people's internet goes out, we have internet available. People are coming and making use of that. We also have computers available for people to sign out for half an hour at a time to come in and use, again, Tuesdays and Thursdays with assistance for people who are technologically challenged. So I do have a couple of handouts, different programs that we have. We're open 6 days a week. Please come in and use the services. Thank you.
Thank you.
Sure can.
Anybody else wish to address the board, please come up, state your name, residency for the.
Janet Sullivan, 15 Mount Lebanon. I apologize, but I got here a little bit late. Did you guys already approve the housing plan for the grant?
Yes.
Yep.
Thank you.
Anybody else?
Teresa Whalen, 43 Orton Drive. This is a request at the park across from Curtis Lumber. We have people that are bringing their dogs, and the dogs are pooping, and they're not picking it up. So in the other parks around town, we have put those bag dispensers with the little, garbage underneath. And we don't have one there. I'm hoping that we have one somewhere, maybe that we could put there. I think all the other parks have them except that one.
Where's that?
Those poop station, you gotta get her one somewhere.
We don't have any.
There's one on James Street. I'm not really sure why it's on James because there's no park over there. Yeah.
We have a whole list, we'll figure out.
Yeah, the only park that we do have one in is Veterans Park. I think all the other parks are posted on it.
Well, there's one, over by Tracy, the triangle. There's one there on Hudson.
Perhaps
Yeah.
maybe one of the organizations would purchase one.
Yeah, because we don't have it.
Yeah, they cost quite a bit of money. Maybe one of the organizations want to step forward and purchase one for us.
Okay. Well, I just didn't know if we had any
No, we don't.
anywhere or, I guess we could just put out a box with bags in it, but
you,
just
Teresa.
thought that would be,
Thank you.
thank you.
Anybody else? Motion to adjourn. Thank you.
We gotta go into.
Yeah, we're going to get a real quick. We all need to.
Good to see you.
Not bad, but.
Okay.